Minister, we heard at the meeting of the Committee of Children, Disability, Equality and Integration that the state is failing children in assessing assessments of needs. We heard from parents, we heard from stakeholders. So, Minister, the question I have is, what is the average time that a child is waiting on assessment of needs in the context that the legal requirements state that the HSE should commence an assessment within 3 months and complete it within 6 months? And can you give a statement on that matter, please? Mr.
Rabbit.
All right. Thank you very much, Chair, and thank you very much, Deputy, for raising this question today and giving me the opportunity to be able to answer this. And I also myself have been observing what has been going on at the Children's Oireachtas Committee, where they've had the families, the Children's Ombudsman and various other representatives in. So the length of time to complete an assessment of need under the Disability Act will vary depending on the child's complexity of need. The average length of time from receipt of applications to the completion of an assessment of need report in 2019 for a child is just under 20 months nationally, but this is considerable variation within the various different community health organisations around the country. The Disability Act in 2005 was commenced for children under the age of 5 years of old age in 2007. The intention at that time was that the HSE would provide assessment of need under the Act for a group only while the Education for Persons with Special Needs EPSON's Acts would assessment for schools for going children. However, and this is the most important part here, the relevant section of the EPSON Act was never commenced. As a result of the High Court ruling in 2009, the effect of which was to open eligibility to all children born between 1st June 2002, and the number of children aged 5 and over, and in addition to school-going age, has risen steadily as the percentage of applications received increasingly, so much so that it's 55% in 2019. This reflects the assessment of need process in accumulative ones in terms of numbers seeking to access it. The recent allocation of €7.8 million, although through Sláintecare and very welcome funding to address the overdue assessment of needs, will further support the HSE and its funded service providers in ensuring children access the appropriate therapies as soon as possible. Deputy, this assessment of needs is a nut we need to crack. There is no denying that whatsoever. The timelines that families are waiting to access assessment of needs has actually turned into an industry.
Thank you, Minister. Deputy Ward.
Thank you, and thank you, Minister, for acknowledging that, because when we're talking about different acts and we're talking about different procedures, it's real people that's behind them. It's parents, it's children, and it has a knock-on effect in relation to the overall family structure, to society in general, to school. It's crucially important that these children, that they receive the intervention and assessment, so there is no lost opportunities. And that's what we're talking about here, Minister. We're talking about lost opportunities for children. Like the dilemma that their parents face in relation to their children reaching their milestones in development. Like some children are being left behind by their peers, they're unable to perform tasks independently, and some are totally reliant on the care that their parents are giving them or their caregivers are giving them. So what we need to do, Minister, we need to start something now, today, as soon as possible, that will ease the access for parents to get their children an assessment of needs when they need it and where they need it as soon as possible. So that's what I'm going to ask you today, Minister. What's going to happen so this can happen in a timely manner?
Deputy Minister Rabbit.
Thank you, Chair. And thank you again, Deputy, for giving me this opportunity to lay out exactly what my plans are and to share with the House here today. So first and foremost, the funding that I would have received through the Sláintecare funding is being actually adequately used to address that backlog at this moment in time. And next week at the Children's Oireachtas Committee, I plan to have all the figures to show exactly how the funding has been spent and how we are achieving that. But also next week I plan to meet with Minister Madigan to address the issue in relation to the EPSON Act. When we originally brought in the assessment of needs tools, it was to actually address early intervention. And when you talk about real families, we should have all our assessments of needs done before a child actually enters into the school setting, where at all appropriately possible. I want to move away from the idea of assessments and get to intervention. That's the conversation I want to get, is intervention. But I do have a plan and we are working really hard on it.
Minister, and I look forward to that conversation next week at the committee meeting. Like we heard from the Children's Ombudsman last week, if you're watching it, that he basically said that it's a three-card trick, an old-fashioned three-card trick, that children are being moved from one list to another list and their needs aren't being met. And I'm glad you mentioned intervention, because that's another problem. When children do get the assessments of needs, and it is outlined what they need for their development going forward, the actual services, wraparound services that they need, whether it's speech and language, wherever it might be, OT, is not there. So that needs to happen in conjunction with getting the assessments of needs. Minister, I have an issue with this talk, and it was brought up by Enough is Enough at the meeting. This, I have it here written, the standard operation procedure, which is a desktop examination where parents fill out these forms and kind of assess their children's needs. Parents have told me themselves they're not therapists. They're terrified that they're going to miss something that's going to delay their child's development. So I'm going to ask you, Minister, do you think this is an appropriate mechanism in getting children assessed and so that developmental needs can be met?
Mr. Rabbit.
Thank you again, Deputy. In relation to the standard operating procedures, which is known as the SOP, the whole idea of that was actually to bring information so as you could put people on different pathways. However, that only ever got off the ground for approximately 6 weeks because COVID landed. So it is, as a new minister arriving in my portfolio, it has given me the opportunity, as I say again, seeking the funding from Minister Donnelly, using that funding appropriately to address with the backlog, while at the same time it is giving me the opportunity to address whether the standard operation procedure is fit for purpose. Will it address the needs of the families? Will it get us the intervention that we need on a timely fashion? And I would hope that the Children's Oireachtas Committee would bring the other lead clinician, Dr McLennan, before them to give the balance of the conversation. I'm not a clinician. I want to hear from the experts. So I would hope the Children's Oireachtas Committee would also invite in the HSE lead on that.